We've got Steve on the line. I think he wants to talk to you, doctor, about skin reduction surgery. Go right ahead, Steve.
Yeah, hello. I was wondering, with all this, it seems like a fairly major physical change. I was wondering, how long is the recovery time?
That's a great question. I think the recovery time is dependent on what you're having done. Now, you may have, for example, if you're just doing your abdominal area, that's about 3 to 4 weeks that I'll tell folks to plan on having modifications of your activities. But if we're doing the abdomen, going around the back and the legs, you may have 6 weeks of recovery time. It just depends. And then some people physically are in better shape when they start than others, and that could affect your recovery time as well.
Are you still out there, Steve? Oh, sounds like he dropped off the line. Do men approach this process any differently than women do with skin reduction?
We see less men than we do women, but about 1/3 of our patients are men. A unique thing for men over women is the treatment of gynecomastia, which is male breast enlargement. We do approach that repair a little bit differently than we would of women, simply because it's a different process for them. The hair-bearing skin does offer different problems. They have higher rates of blood collections called hematomas than women do. We tend to do or see less arm work, as we will see primarily. I'm not sure I can remember doing an arm reduction on a man in the last 12 years. That's mostly, I'd say, for women.
We have, is it Tiana on the phone with us tonight? Go right ahead. Did I get your name right?
It's Tanina.
Tanina, sorry, go ahead.
Yes, Dr. Mancoll done my surgery 2 years ago, June 20th. He done reconstruction.
Yeah, I think your television's up in the background and it might be confusing you with our delay.
Yes, just a moment.
Yeah, I'll turn that down.
And he done a wonderful job. I'm going to tell anybody, if you need to have surgery done, Dr. Mancoll's the man to do it, because I don't have hardly any scar.
Well, thank you
for
very
my
much.
surgery.
Well, do you mind sharing a little bit with us, if it's not too personal, about your surgery? What did you have?
Breast cancer.
A breast cancer?
Yes.
Well, I'm glad to hear you're doing well.
And he done the reconstruction, and he done a wonderful job. And I had a foster sister up in Saginaw that had breast cancer, and I went and seen her back in April, and her doctor done a terrible, terrible job. She's got a nasty scar, and I tried to talk to her to stay down here in Auburn, in Fort Wayne and that, to have her surgery done here, because Dr. Mayo and Dr. Mancoll both done a wonderful job for me.
Well, thanks for your call. I appreciate hearing that. Good news. You know, I didn't go down that path earlier, but that's probably a good place to go, and that is reconstructive surgery. Your practice does a fair amount of reconstructive surgery, not only in the case of cancer patients, but accidents and other issues. Tell me more about that.
Well, I think we have a bit of a unique practice here in this part of the country, Midwest and northeastern Indiana. Probably the bulk of our practice is still based in reconstruction. As you mentioned, after cancer, whether it be skin cancers, head and neck cancer, breast cancer is a big part of our practice. We're also intimately involved in the trauma services at both Parkview and Lutheran Hospital, where when folks get in accidents and they're missing soft tissue, or the orthopedic doctors have bones that are exposed, that the healing of that bone is critical to have good skin coverage. That's where we come in. And then, as we talked earlier, burn reconstruction. I'm not sure why we see a difference here versus perhaps like on the East Coast or West Coast. Maybe it's the weather. We see less people in shorts for less of the year, so from a cosmetic standpoint, there's more need perhaps elsewhere. We have a lot of healthy people here too, and you know, kind of farm living and sort of Midwest living. Maybe it's a little different value system than in other places as well.
Marla's got a question for us tonight. Marla, go right ahead.
Yes, I was calling. I've had a large weight loss, and I really need some skin removed everywhere, but I'm more concerned at this point about my legs. I don't know if that's something that normally is considered medically necessary, because I know the insurances don't cover, you know, like cosmetic surgery usually.
Where on your legs in general? Is it around your knees, ankles, up in the thigh region?
Kind of, mostly from the knee up, but you know, I've just got a lot of extra skin. I've got some bulgy varicose veins that even seem to have gotten worse since the weight loss.
How could you help Marla?
Well, I appreciate your dilemma. The veins themselves probably are no different than they were. You just have less fat hiding them now. They're not sort of trapped underneath all that layer. You're right, the legs are a hard area to get insurances to pay for. They're a tremendous problem when you've lost all this weight, particularly the outer thigh area, the back and the buttock. We have some great operations that can almost, you can't believe the before and afters in some of those cases, but it's harder and harder to get insurances to pay. I don't personally consider that purely cosmetic. I think there's a real functional component with that, but I've got to convince the insurance companies with that. I will tell patients, though, if you're persistent, I do believe you can get stuff covered. And you asked me earlier, when should they start? I mean, it's not uncommon for it to take 12 months to kind of work the process.
Is that right?
Yeah, so you got to sort of put that in your plans. It's not something that's going to happen overnight from an administrative standpoint, and working with the insurance companies.
Thanks for your call, Marla. Michelle, you're up next. You have a question about a child who was burned? Tell me more.
Yes. I have, my daughter's 14 months old, and she fell while someone was on a treadmill. Got her hand caught underneath the guard treadmill.
Mm-hmm.
The treadmill was turned off immediately, and her hand was just tore up, something awful. And I just knew it was a wound that I couldn't take care of at home. It didn't occur to me until we were in the ER that it was a burn. So my question is, how do you determine a burn when it doesn't have anything to do with fire? And how would you decide if you should go to the burn unit?
Well, in general, we're happy to manage any wound in the burn unit. Fire seems to be the most obvious when you think of burns, but your daughter had a friction burn with a treadmill, and we probably see a couple of dozen of those a year, especially in the kids. And it's the trauma to the skin is no different whether it be road rash from a car accident or a fire or a chemical or even hot water or scald. So I guess I'll encourage anybody, if they're not sure how to manage a wound or what to do, they're welcome to come to the burn unit. We'll sort of take a look and see if it's something that needs our specialty care, or can we refer back to the family doctor with a plan or the pediatrician. But I hope your daughter's doing well, and we're happy to even look at the scars that come from that.
We'll have to do a program in the future, John, about scar revision and surgeries. I'm sure that would touch a lot of people.
Absolutely.